myself. Now, unfortunately, I'm not in a position to deliver a talk that's anywhere in any way similar to the one we just heard. I have not myself been involved in any translation of basic research findings into practical applications through startup companies or things like that. Neither has our department as a whole, which I'm representing today. So instead of doing that, I would rather like to give you a broader overview of the opportunities that are available in the area of Heidelberg and Mannheim, or the German component of the EU program, is located, so that you have an idea about how this area as a whole fares as an innovation environment. As you know, there are two basic players in bringing clever ideas to practical applications, to the market, if you will. The one is the academic sector, and the other is the non-academic, mainly in the case of the research we're interested in, the pharmaceutical and biotech industry. Basic research, there's obviously a heavy focus typically on, in academia there's a heavy focus on basic research with some translational research, but product development is really not something that a university or a peer research institute is well suited to do. The pyramid is obviously inverted in industry. The raison d'etre is to produce a new product which they can sell for money, and hopefully somebody can also benefit from it in the process. And especially nowadays, I think there's, especially in larger companies, there's very little basic research being done. They mostly rely on the basic research findings that are made in academia. And obviously there's a bit of a gap. We already saw this cartoon with the value of death between the basic and the clinical research, or in this case also the industry which is putting this basic research into practice, and then this is what gets fueled by the translational research component. We saw now that clearly people in academia realize the need for translating their findings into practical applications, and it looks very much the same from the point of view of companies. This is a cartoon from Sanofi, one of the larger pharmaceutical companies in our area, which sees translational medical research and open innovations as the two pillars for getting new products to the market. And what they understand by open innovation is they actively search for collaborations with basic scientists or perhaps smaller companies that have a specialized expertise in areas which are not being developed in the larger companies, but certainly the larger company then has a lot of muscle to help those smaller players, if you will, really translate their measures. For example, one thing they mention is a large chemical lab that can be used for compound screening. This is also a topic that was already mentioned in the previous talk, the two definitions of innovation. Perhaps one way to approach it is to take kind of the more specific definition of the new method, new compound, new process, and then call that one invention. And that's something that you can do just in your lab. You don't need necessarily the big research, the big innovation environment for that, but innovation, bringing that invention, or sometimes a group of related inventions towards a practical application, towards a new product that meets some existing or unarticulated market needs or new requirements that emerge or have been imposed through more effective products and so on. This is a much larger process that I would call here innovation. So why does one need, I'm supposed to talk about innovation environments. Why does innovation need any particular environment? The reason is that it's a very complex, very costly, very long process that requires interactions between a number of different players. This may be a chart that you are in one or another form familiar with. This is the typical kind of innovation that we have in the health sector, bringing some basic discoveries to a new kind of therapy. It can be useful to patients, which starts, for example, by identifying a new target protein or a new biomarker diagnostic method. And this is the point at which can and often is done in basic research laboratories, but this is pretty much the point where it ends, and they cannot proceed any further unless they partner with larger companies, either smaller or larger companies, to develop this as a possible intervention, initiate early phase clinical trials, and if those are successful, this can then proceed to late translation with phase 3 trials. If successful, those could lead to regulatory approval of the product. And this is, many people see this as kind of the end goal, but this is really only half of the way. Many other things are involved afterwards, which also cost a lot of money. Here we are already at 1 or 2 billion, and the costs continue, with dissemination of the. So people have to know, both the doctors and the patients have to know that this thing is there, that it works, and it can be useful over what's already available. And there are many other components. One thing we heard of is that even if we have this therapy that the company and maybe the doctors and the patient thinks it's great, but the insurance companies don't agree and do not reimburse the cost of it, it's not going to get widely adopted because treatments nowadays are extremely expensive, and hardly anyone can afford to pay them if they're not covered by health insurance. So there are many aspects of this. This is a process which I think on average continues around 15 years in this forward direction, and that's in the cases which are successful. And it's not a linear process going from left to right, but there are interactions between the different steps in both directions. For example, early clinical trials may reveal that your target is useful, but it's only useful in a subset of patients, and then you have to go back to your basic lab work and try to identify how to best define this subset of patients that's going to optimize the process. So this is why we need the innovation environment, because it's a very complex process. It requires interactions between many different players, and then it helps to have a local environment, a local concentration of expertise at these different steps that can more efficiently cross-talk to each other. So how does the area around Heidelberg and Mannheim fare in this respect? I think it fares rather well, even if we weren't shown on this graph. Germany wasn't on this list of the best innovators in Europe. I think we're still not doing too poorly, especially in the local environment in Heidelberg. There are several top research institutions in that area. One of them is the University of Heidelberg, which hosts the German component of the IMIM course. It has 2 medical faculties, one in Heidelberg, one in Mannheim. And both the university as a whole and the 2 medical faculties are among the top ones in Germany. I'll talk a little bit more about that tomorrow. Another major institute that's located in Heidelberg is the German Cancer Research Center, or DKFZ. It employs around 3,000 people, and that makes it the largest biomedical research institute in Germany. It's part nowadays of the Helmholtz Association, which unites a number of such very large institutes focusing on different areas of research. But in the biomedical field, this is the largest institution in Germany. Another prominent institute in Heidelberg is the European Molecular Biology Laboratory. This is a pan-European institute which primarily focuses on basic research and has by now outstations in a number of European countries and even outside of Europe. But its main and largest laboratories are located in Heidelberg. Another institution which is an important player in the field is the Max Planck Institute of Medical Research. It's a part of the Max Planck Society, which is the top research society in Germany in terms of research output. Worldwide, it's the third best publishing, publishing and patenting science. When you take also the translational aspects, it's ranked third worldwide after the Chinese Academy of Sciences, which leads the list nowadays, since a couple of years in the University of Harvard. Another institute in the vicinity is the Karlsruhe Institute of Technology, with several large campuses. It does not have a biological or medical faculty, but it has strong, well, it does have a biological faculty, but the main focus there is on chemical technology and other technologies which can support other aspects of the innovation process. The last thing I wanted to mention is the Fraunhofer Institutes. There are a couple of those in the area, and the Fraunhofer Society in Germany focuses on supporting applied research. The rest are focused either on basic or more translational aspects. So this gives you an idea about the geography of all these places. So from here to here, they're about 150 to 100 kilometers. This is kind of the focus here in Heidelberg and Mannheim. And this chart also shows some of the big hitters in the area in the pharmaceutical industry. For example, we have Roche Diagnostics located in Mannheim. In Darmstadt, which is a little further away, the headquarters of Merck in Germany. Sanofi is in Frankfurt. Ingelheim is close to Mainz. Just across the river from Mannheim is AbbVie, formerly Abbott Laboratories. In Ludwigshafen, near Karlsruhe, there's a center of Pfizer, and in Heidelberg, there's a subsidiary of GlaxoSmithKline called Cellzone. If you go a bit further north, there's Johnson, belonging to Johnson & Johnson, and a bit further south in Basel, there's Novartis, and another big center of Roche. Part of our component of the EVIN program are visits, on-site visits to some of these companies. Last year we had an on-site visit to Merck, and within the spring school there was also a visit to Roche Diagnostics in Mannheim. I think there's similar events planned for this year. So in addition to these multinational, multi-billion-dollar pharmaceutical companies with tens of thousands of employees worldwide, there are also many smaller, medium-sized enterprises in the area which work in the area of biotech or pharma. This is only a selection of those. And I would just mention one of those, kind of almost a random selection, in part selected because we have done a little collaboration with that company in the past. It's a company located near Karlsruhe, or in Karlsruhe, called MCure. They again are a spin-off from basic research laboratories. They have been focusing on this surface molecule called CD44, and on a particular variant of this molecule, so-called V6, which they found to be highly overexpressed in different types of cancer, and moreover they found that CD44 acts as a co-receptor, different receptor tyrosine kinases, which are involved in those cancers, and have managed to generate a small molecule which disrupts these interactions, blocking downstream signaling, and they have managed to bring this now into phase 1 clinical trials, which, as I understand, are in good way. But this is just one very small, very specific example of this. In the city of Heidelberg alone, I believe there are about 100 different startups or small and medium-sized enterprises that work in this area. The process of bringing things from the basic research lab to an industrial application to starting on the road to innovation, often needs support from people who have expertise in these things, so-called technology transfer centers, and we have a number of those in the area. For example, the one from the ESGR is called Emblem, and there are also other technology offices in the area which help to bring basic researchers, establish connections with them and industrial partners, or support people on the way of founding a startup company. How does it look in Mannheim? So, as I will explain tomorrow, most of the teaching in our branch of the evening is done on the Mannheim campus. The Technology Transfer Center is called CubeX 41, and it has already promoted the founding of several smaller, medium-sized companies. It works in close collaboration to that end with the Fraunhofer Institute for Automation in Medicine and Biotechnology, which is also located on the campus of the medical faculty. They, as I mentioned, the Fraunhofer Institutes in Germany, they focus on more applied aspects of science. Here you can see the main areas of focus of the Fraunhofer Institute, and based on those, several of the companies I showed on the previous slide have been created. I just want to mention one of those, which is kind of more of an initiative which combines clinicians, translational researchers, and automation specialists, if you will, partly from the Fraunhofer Institute. They've created this company called MOLI, or others call themselves the Intervention Room of the Future. So what they're doing is they are they're coupling different robotic systems and automation processes to speed up the diagnosis of patients with that have presented, cancer patients that have presented with metastasis. We already heard about the importance of speeding up the diagnosis and treatment of such patients, and this is especially important when the patients already have metastasis. And by coupling these automated systems for imaging, the taking of biopsies from individual metastases, the analysis of those metastases by mass spec in this case, which is used to guide minimally invasive radiotherapy, has dramatically shortened the time, up to 6-fold shortening of the time that goes from admission of the patient to radiotherapy and discharge. In particular, I think breast cancer patients, but also other patients are being treated in this way. Something else I wanted to mention, so far nobody talked about EIT Health. You probably are familiar that a substantial chunk of the funding of the immune program comes from EIT Health. This is a branch of EIT, which is the European Institute of Innovation and Technology. That is part of this Horizon 2020 framework program of the EU, which is the main research and innovation funding tool of the EU, with a total budget of 80 billion, and the EIT has a sizable chunk of that budget, almost 2.5 billion. And EIT Health is one of its branches, the so-called KIC, Knowledge and Innovation Community. And they have different co-location centers, and I think there's one in Uppsala. Yeah, there should be one in
Stockholm, I think, one of the sites.
EIT Health, we have also here on campus.
Yeah, exactly. And so do we in Heidelberg. In fact, there are two co-location centers of EIT Health in Germany, and they are both, one is in Heidelberg, in the university campus, and the other one is in Mannheim on the premises of Roche Diagnostics. So what they are doing, and we work rather closely with them within the framework of the immune program. So basically they aim to improve health. Their three aims are either to promote healthy living, so that people don't get sick in the first place, support active aging, high age being, advanced age being the highest risk group for most of the toughest diseases, and if patients do get ill, then improve healthcare. And the three pillars that I use to support this work is, first of all, by funding specific projects, so you can apply for funding from these $2.5 billion for specific projects. The second pillar is the so-called EIT Health Accelerator. That's kind of the analog of the technology transfer support. So entrepreneurship, helping the funding of companies and the interaction between basic researchers and industry. And third pillar is EIT Health Campus. This is where the EMING program comes in most directly. As you heard, they are already they're sponsoring a number of master's programs and other advanced courses, and they have already a number of graduates, and this one this year, the first course of the EMING counts among those. And just to wind up, so one of the things that EIT Health sponsored last year was the Spring School that was already mentioned. You heard the presentation about what the Spring School involves. It wound up with this so-called Industry and Innovation Day, in which the EMING students were also involved in the organization, but a lot of the heavy lifting was done by Susanne Hauselt, who is our study coordinator, and Lenka Kiatsu in our department. And you get the chance to network with people from academia and industry, think and discuss your career perspectives, and if you want you can also present a poster about your work or about your ideas. And I think probably the best advertisement for this Spring School, in particular the Industry and Innovation Day, was that the students who did it last year, several of those told us that they liked it so much that they want to spend their travel grants next year to visit it again. We'll have different people speaking, we'll have different topics in the same area, but it will be a new event, a different event, and I hope that you will also be looking forward to that. Okay, with that, I'd like to thank you for your attention, and if you have any questions, I will be happy to take them.
Thank you very much. Short questions? Clear cut?
I do. Will we have opportunity to maybe do